Looking to lose a little weight? Just freeze it. The negative results of fat freezing are far from anything you want to see on your body. Some of the results of these risks don't appear right away during the procedure. They show up later. Simply put, this is where your expectations may not match results, and fixing is far more invasive than the original procedure.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Welcome back. I'm Sam, and this is BeautySeek. Thank you for joining us as we explore the beautiful results possible and the risks of fat freezing. Looking to lose a little weight on the belly, underarm, inner thigh? Just freeze it. All you need is a fat freezing machine, the right operator, and to be aware of one of the biggest risks that can result from using fat freezing machines. The appeal is obvious. It sounds simple, it sounds controlled, but simple doesn't always mean harmless. Fat freezing is a non-surgical body contouring treatment that uses controlled cooling, known as cryolipolysis, to damage fat cells beneath the skin. It's FDA-cleared for areas like the abdomen, flanks, thighs, arms, and even under the chin. What most patients don't realize is that FDA-cleared does not mean risk-free. There are risks, including complications that many patients aren't fully warned about before they book a fat freezing procedure. Some of the results of these risks don't appear right away during the procedure. They show up later. Fat freezing appointments feel quite simple. You lie back, the applicator is positioned, and you feel cold pressure, sometimes discomfort, until numbness sets in. Sessions typically last under an hour, and at the end of the procedure, the hard part feels over. You go home, no bandages, no downtime, no obvious warning signs. For many, the fat freezing process leads to gradual fat reduction over weeks to months. This is where you relax and think, that was easy. This is where most patients aren't concerned about delayed complications because visually nothing looks wrong initially. During this relaxing time is where unwanted results start to set in. And the time delay of those risks deserve far more awareness prior to the procedure than it often gets, because what can happen next doesn't feel connected to the fat-reducing objectives of the procedure at all. Simply put, this is where your expectations may not match results at all. One of the most serious complications associated with fat freezing is Paradoxical Adipose Hyperplasia, or PAH. PAH is a rare but significant side effect where the treated area grows larger instead of shrinking. It typically appears several months after the treatment and is characterized by a firm, painless enlargement of fat tissue that can simply be something you do not want hanging off your body. By the time PAH appears, the original appointment is a distant memory, and although rare, it's not impossible. While considered uncommon, a 2025 review in Aesthetic Surgery Journal shows that PAH affects about 1 in 455 fat freezing patients, often months after treatment. And again, while uncommon, the negative results of fat freezing are probably far from anything you want to see on your body. PAH is far more than a minor side effect of fat freezing. Instead of reducing fat, tissues thicken and expand, and often in the exact shape of the treatment applicator. The very device meant to contour the body can leave a visible, firm reminder of the treatment itself. One of the most widely reported cases involved supermodel Linda Evangelista, who publicly shared that fat freezing left her permanently deformed, requiring corrective procedures and causing years of emotional distress. She stated that the treatment did the opposite of what it promised, and fixing PAH is far more invasive than the original procedure. The firm, noticeable protrusions of PAH do not magically disappear. They do not dissipate on their own. And in many cases, to fix it, you'll need to pay for surgical correction, like liposuction or excision, meaning cutting it out. Understanding risk isn't about fear, it's about informed decision making. Before considering fat freezing, consider exploring the questions you should be getting straight answers to prior to booking the procedure. I'm Sam, and this is Beauty Seek. Subscribe to receive more straight talk so that you can make informed aesthetic decisions. Next, 20 critical questions and answers so that you can make more confident decisions regarding fat freezing.